Respected Reverend David V. Titus, the Vicar of Bahrain Marthoma Church, Reverend Bibins Matthews Omanali, Assistant Vicar, our guest speaker, Dr. BHANU VASUDEVAN, Consultant Obstetrics and Gynecology at American Mission Hospital, respected office bearers, committee members, Sevya Sangam office bearers, and my dear brothers and sisters, a very good morning. I feel so honored to stand here as we welcome someone who is very dear and close to me. Dr. BHANU and I worked in the operating room for many years at American Mission Hospital. I have come across very few personals who have a healing touch that has heavenly blessings coupled with. Dr. BHANU is outstanding in her field, who has over the many years made a difference in the lives of so many. I am confident that today's session will be beneficial to all those who are attending. Please join me in welcoming Dr. BHANU in our midst. Sorry about the delay. Please join me in welcoming Dr. BHANU, please. Thank you. Our Vicar, Reverend David V. Titus, has always been a very motivational force behind every successful program. With his guidance has helped us. Achan, we welcome you. Our Assistant Vicar, Reverend Bibins Matthews Omanali, always has that cheerful face which is so encouraging to all of us. Thank you for your guidance and prayers. We welcome you, Achan. Our church office bearers, committee members, Sevya Sangam office bearers, we welcome you for this interesting and knowledgeable session. In one word, we also welcome everyone who have come for this session. Sit back, and I'm sure the knowledge gained today will be worth the time spent with Dr. BHANU. Thank you, and may God bless you all.
ദൈവനാമത്തിന് മഹത്വം ഉണ്ടായിരിക്കട്ടെ. നമുക്ക് ഇന്നത്തെ സെവിയ സംഘത്തിൻ്റെ ഈ മെഡിക്കൽ സെമിനാറിൽ തൻ്റെ പേരിൽ തന്നെ ഒരു പ്രകാശത്തിൻ്റെ പ്രതീകമായിരിക്കുന്ന സൂര്യന് തതുല്യമായ പേരുള്ള ഡോക്ടർ ഭാനു, പേർഷ്യ പ്രദേശങ്ങളിൽ പെൺകുഞ്ഞുങ്ങൾക്കിടുന്ന ഒരു പേരാണ് ബാനു, BANU. Bhanu, it is called Surya. Ravi, Pushan. There are many synonyms related to this name Bhanu. More or less, it is quite intrinsically related to Lord Shiva and Lord Krishna as well. The main combination is Bhanu VASUDEVAN. So it adds to the nobility, it adds to the background in which God prepared her to be a healing force in this world, especially to the weaker section, so-called weaker section called women. So this morning, dear Bibin Sachan, dear Daisy Madam, dear Jinu, and all the office bearers of the Sevya Sangam, all the distinguished audience present here, male as well as female, we are indeed happy that we got a very meaningful, wise, erudite doctor for this medical seminar, and I won't take your much time and conclude my presidential address with all my wishes that this seminar may be a very useful in the life of our being mother, sisters, daughter-in-laws, and all the things we are bearing as family member of our parish. And may God bless Doctor in all her pursuits. In the coming minutes, she is going to lead the seminar. Thank you. I invite Dr. BHANU VASUDEVAN to lead the seminar and bless us.
Good morning, everybody. My voice is okay or louder? It's okay. It is my privilege or blessing, I should say, to be with my passion, that is women. That's why in my life for the past 42 years I have been with women from the time I passed. It is God's blessing, nothing else. And it's first I thank the Lord for this wonderful blessing. I thank Achan David Titus and also Reverend Bibbins Matthew. Talk will be in English and Malayalam. I'm not going to bore with tablets, injections, everything. Minimum, but what do we do for this will be the minimum. You can interrupt, or at the end also we will definitely have a question and answer sessions. I want more interaction from you all, which will benefit everybody. So the talk of today is Polycystic Ovarian Syndrome. You keep hearing it everywhere. എല്ലാവരും പറയുന്നുണ്ട്, ഓ എനിക്ക് PCOS ഉണ്ടെന്ന് പറഞ്ഞു, PCOS ഉണ്ടെന്ന് പറഞ്ഞു. Right from the child to the old lady they said. എന്താണ് polycystic ovary? Let's see what it is. Very common hormonal problem in women. What does the name suggest? Polycystic means cyst, multiple cysts in the ovary. Ovary in ellarku ariyam. Cyst means water containing, neer katti, anganeyokke parayam. Okay? It's very common, 4 to 18%, sometimes 26%. Most important one which we have to bother is that it can start as early as 11 to 12 years. More common now because we see so many young girls coming with symptoms of polycystic ovaries, but of course the mothers are not aware that this is because of this, so they come very late after years. So that is why this talk. And this is a lifelong condition. Symptoms can change. Different age and different symptoms varum, may manifest in different ways. Can PCOS be cured? There is no cure, but there is nothing to be depressed. Symptoms can be controlled. എന്തിനാ ഈ polycystic ovarian syndrome ഇത്ര നമുക്ക് importance കൊടുക്കുന്നുണ്ട്? What will happen if you don't treat it? It can lead to blood pressure, cholesterol, sugars, and heart disease. So it's got a lot of implications. That's why we are worried about PCOS or polycystic ovarian syndrome. As I said, there is no cure, so it can go on. And usually menopause കഴിഞ്ഞിട്ട് symptoms ഒന്നും ഉണ്ടാകത്തില്ല, but rarely women can still have. What is causing this? Nobody really knows the real cause. They are saying it can be genetic as well as environmental factors. There is no one gene, അങ്ങനെയൊക്കെ ഈ ജീൻ ഇങ്ങനെ abnormal ആയിരുന്ന PCOS വരും, അങ്ങനെയല്ല. There is no particular gene, but there is definitely a genetic factor because അമ്മയ്ക്ക് polycystic ovarian syndrome and the daughter can get. If the sister has got, then the sisters can get. So there is definitely some genetic factor is there. But also it's got complex environmental factors. They say that during pregnancy, exposure to toxins and epigenetic factor, environmental impacts. Okay? So it's a multifactorial disease. What is causing that? I will keep it as simple as that, but it's better to know. The main factor which is abnormal is ellarum kettundavum insulin. Kettundo. Insulin is the main hormone which is involved in diabetes and everything. So there is a hormone called insulin which is secreted by something called pancreas. That is the one which is the culprit. Insulin resistance. Insulin resistance means blood insulin unda, but adinte action is not able to take place because body is resisting the action. So, idu karanam endha avanunda. See, in the picture, that is the hormonal axis in every girl or woman's life. Okay? In the brain, there is something called hypothalamus. Then comes the pituitary. These two are in the brain, pinna ovary. So the hormones always have one hormone from the higher center, pinna oru hormone varum, pinna ovary la. Adana effect. Ipo ee insulin resistance ulladu karanam, this will affect the pituitary secretion. There is some hormone called luteinizing hormone, excess ana. Idu karanam, male hormone. All the women have little bit of male hormones, all the men have little bit of female hormones. Appo, a male hormone excess ana. Where does it come from? Ovary. So mainly, all the factors are because of the insulin resistance and the excess male hormone called testosterone. Idu karanam endha avanunda. Appo ovary la, normally what happens, egg will grow and then ovulation happens. Pregnancy can happen. Pregnancy aayitillengil that egg will get discharged. Okay? Because the male hormones are there, female hormones, estrogen kettutunnaam ellarum. Estrogen is not able to have any effect on these eggs or follicles. Appo adu valaranilla. Appo every cycle, every cycle, menstrual cycle, every cycle is continuous at ambo, there is cyst. That is what is polycystic ovarian syndrome. As long as we understand male hormone excess ana, insulin is the one. These two are the problems in this. Okay. So what happens? Idla symptoms endana. It can be very different. It can be right from problem in the menstrual cycles or periods varanadila, allengil not able to get pregnant, or because of this advanced symptoms. It is a spectrum. When you say polycystic ovarian syndrome, one person can just have ovary polycyst maatra irkam, allengil some hormonal imbalance, allengil full-fledged disease, which I am going to show in the pictures. Okay? Menstrual cycle endavum, sometimes oligomenorrhea, masam varanalla period, once in 3 months, 4 months, like this, adu varanunda. Allengil no period at all. Or you can have heavy periods, some disturbance because of the hormonal imbalance disturbance. Idu karanam endanu njan already paranju, ee ovulation nadakkan pattanilla because the hormone, male hormone is high. Appo estrogen matramana undagum. Ee action on the estrogen, overgrowth of the, normally ee uterus level lining ana endometrium nu parayunnathu, that will get expelled during every period. Appo idile endavum estrogen maatra ulladu kaanam, that will get added on. So that is called hyperplasia and overgrowth of glands. Everybody doesn't happen, some people untreated. Suppose idu ingane poikondirikkunathu, appo nammal treat cheyidilla, rarely it can become cancer in the uterus. So that much importance is polycystic ovarian syndrome. I'm not trying to scare you. I will tell you how to get rid of it. Okay? Because ovulation nadakkaada karanam, people are not able to get pregnant. That is called infertility. Adu maatra illa. Even now, many times you have seen girls having kururalo, acne, we'll say, Adu, everybody who has acne does not have polycystic ovarian syndrome, but severe one. Like the middle picture you can see. Severe one, or sometimes hair growth undavum, evidellam hair, pinna all chest, abdomen ellathilum hair nannathu, pinna there is some black patches in the neck. That is also typical of this, because of this high male hormone. So then sometimes hair, male pattern baldness can come, bald aganathu angane. So all these can also come. So first is, I said, periods la endengilum problem undagam, or they need not get pregnant, or third one, it can be like this. These can come even in young girls. They don't have to be adults and get married and everything. Associated, what else can be there? obesity. Weight is very important. About 80% of the women with polycystic ovarian syndrome are on the obese. But 20% still are very thin. But very important factor which we will talk later is weight, obesity. Pinna, they can have sleep apnea, is they having stopping of breathing during sleep, and then they can have mood swings. Especially, see, can you imagine the young girls' weight and all this hair growth on the thing, peer pressure so much. Our age la, why am I looking like this? Physical this thing. So they can go into anxiety, depression. Adu karanam, either they will overeat or they will not eat at all. Even women, when they are not getting pregnant, social pressure, family pressure, adu karanam. So that is how the mood swings are coming. Pinna, these, as I said, they can also lead to diabetes because insulin resistance ullada karanam, they can lead to diabetes and heart problem, blood pressure, everything which we already talked about. See, in this, it can cause anything. When you say acne, it can cause excessive facial hair, or it can have loss of hair. Where it has to grow, it will not grow. It will grow on the face and chest and everywhere. And you can have irregular cycles, not getting pregnant, pain sometimes can be there, but very rare. Pinna, weight gain. Okay, these are the symptoms mainly. How do we diagnose? Suppose you are coming to the clinic, somebody is overweight, little bit of hair, but can I say that, okay, polycystic ovarian syndrome ആണ് dump ചെയ്യാൻ പറ്റത്തില്ല? There are some criteria definitely to have diagnosis. So, അപ്പോൾ ഞാൻ പറയുന്ന 3 things, at least 2 things ഉണ്ടാകണം. Then only I can say that this may be polycystic ovarian syndrome. Irregular cycles, പിന്നെ blood test ചെയ്ത് ആ male hormone high ആകണം. That's one of the very important factors for polycystic ovarian syndrome, and ultrasound la polycystic ovarian. See, sometimes what happens, irregular cycles at 11 years, 12 years, ammar kondurum. Appo scan cheyidittu chira multicystic adu karanam. I will show you in the ultrasound later what is the difference between polycystic and multicystic. Appo nammal chira cyst nu paraya ellarum ayyo PCOS aanu ende molna ayyo devame endana anganeyalla. There is something specific called polycystic ovaries, but suppose somebody has polycystic ovaries on the ultrasound alone, I cannot say that it's syndrome. So when we have all these diagnostic factors together, then we will say, yes, she has polycystic ovaries. As I said, blood test, the male hormone should be high, then fasting insulin will be high, showing that insulin resistance. Sometimes already they will be having abnormal sugars. So important to do the thing. Then ultrasound is polycystic. See, in this, that picture is a normal ovary. Okay, you can see some follicles. This is the one which is polycystic ovaries. See, your blob like undalo, dark blobs like thing. That should be in the periphery of the ovary. Angane illade multicystic means you can have all over the ovary. That means young girls are very common to have. So, that is not polycystic. You must have specific like this. That is polycystic ovaries. This is a very typical picture. Again, I am insisting adolescent PCOS, very common. Right from 12 years. Okay, we can wait for at least 2-3 years to see that periods may not be very regular because our hormonal axis mature alla. But if your daughter is putting on weight, and she has this hair growth thing, then periods are irregular, please come and see the gynecologist. Okay? Better to rule out. If we say polycystic ovary, this is normal, very good. Otherwise, because most of the adolescent girls come very late, and by then all the insulin resistance and everything is very high. That is, we should be aware of this. So in this, you can see how bad the mustache is almost growing for that girl, and very bad acne for this girl. So I already said what are the things which we see in this women. So now we have diagnosed that somebody has polycystic ovarian syndrome. What do? Do we jump into taking, okay, this tablet, that you go to Dr. Google will say 1,000 tablets, 1,000 injections. They'll say like this. And many people also will say, enter molna angane endu ketto, njan idu koduthappada better ayadu. Because I always say, when we ask about building, people will say, oh, go to a contractor and ask. When you go to engineering, they will say, go to engineer. But when we ask for a medical doubt, nobody will say, go to a nurse or a doctor. എല്ലാവരും പറയും, എൻ്റെ എക്സ്പീരിയൻസിൽ ഇതാണ് ചെയ്യണം, അവരുടെ എക്സ്പീരിയൻസിൽ അങ്ങനെയായിരുന്നു, ഞാൻ കണ്ടു അവരുടെ അങ്ങനെയായിരുന്നു. അതല്ല. So, do not take any tablets by yourself and listen to the doctor, go to a proper doctor. Okay, lifestyle modification is the most important one, which we are going to prevent the progress of polycystic ovaries. So what do you mean by lifestyle modification? Healthy lifestyle behavior, healthy eating, healthy physical habits to achieve and maintain a healthy weight to optimize health. Okay? So how do we gain? I said weight loss. How do we gain the weight loss? How do you calculate? The goal should be a smart goal. Somebody is coming 150 kilos. I cannot tell them, okay, within a month you have to become 90 kilos and then you come back and see me. It's not possible. So your goal should be smart. That means it has to be simple. ഞങ്ങൾ പറയുന്ന അഡ്വൈസ് സിമ്പിളായിരിക്കണം അവർ ഫോളോ ചെയ്യാൻ. പിന്നെ ഇറ്റ് ഷുഡ് ബി മെഷറബിൾ. ഓക്കെ, ഇതിൽ എത്ര കിലോ ഇതായി, അങ്ങനെ ഓൾട്ടറായി ലൈഫ്, അങ്ങനെ വേണം. പിന്നെ അച്ചീവബിൾ. If I am coming to the doctor, what the doctor says, I should be able to do it. And realistic and timely. ഇത്ര മാസത്തെ ഇതാകണം, അങ്ങനെ പറഞ്ഞാൽ നമുക്ക് ഈസിയാണ്. അങ്ങനെ പറയാതെ you say that, okay, you reduce and come back. When do you reduce? When do you come back to the doctor? What is your goal? So, when you say weight loss, 5 to 10% of the excess weight in 6 months. They say that even 5% weight loss undengil, that can regulate the ovulation, that can make so many changes in the body. Okay? Pinna, you must have a diet plan. I will explain in detail. General healthy diet, no particular diet. There will be PCOS diet, anganella. What is, that may be a Western diet. നമ്മുടെ ഇതിൽ എന്ത് നമുക്ക് കഴിക്കാൻ പറ്റുമോ അത് നമുക്ക് പ്ലാൻ ചെയ്ത് നമുക്ക് കഴിക്കാം. No particular diet is advisable. Calorie deficit. You should reduce the calories by 30%. That is 1200 to 1500 kilocalories. Individualized approach is the most important. What is the body weight now? What is the energy requirement? See, somebody can be sitting at home and having only a sedentary life, but somebody can be doing a manual labor or very busy from morning to night. Pinna, food preferences. You cannot give the non-vegetarian for a vegetarian. You cannot give full Western diet for an Indian. I will not be able to tolerate a Western diet. So like that. And then physical activity, as I said. So it should be tailor-made. What is tailor-made? നമുക്കൊരു ഡ്രസ്സ് വേണമെങ്കിൽ ടൈലർ എടുത്ത് പോയിട്ട് നമ്മുടെ അളവ് കൊടുത്ത് നമ്മൾ തയ്ക്കുന്നുണ്ട്. അതുപോലെ every plan should be an individualized, tailor-made, depending upon the age of the person, weight of the person, what is the requirement, what do you want? Does she want to get pregnant, or is she a 16-year-old girl, or her hair growth is the main problem for her, and whether already diabetes is there? ഇതെല്ലാം വെച്ചിട്ട് ഒരു പ്ലാൻ വരച്ചിട്ട് പിന്നെ അതുമൂലം നമുക്ക് ട്രീറ്റ്മെൻറ്റ് ചെയ്യാം. So when you say, I'm just saying what is given in the book, I think you cannot follow this plan, but for example, I'm just telling this. Because you need to go to a doctor and dietitian and educator like Susan. Even if I have, I will go to Susan. So the specialists are there to plan our lifestyle. So when it's a mild lifestyle, they say that for the adults, minimum of 150 minutes per week moderate exercise cheyanam, or 75 minutes per week vigorous exercise, including muscle strengthening exercises. Okay? You plan according to what people advise. Adolescents also, at least 60 minutes of moderate to intense activity per day. And activity should be at least 10 minutes bouts, around 1000 steps, or to achieve at least 30 minutes every day. ഇപ്പോൾ നമുക്ക് ശരിക്കും ഓക്കെ വീക്കെൻഡ് ഇത് വരും, ഓക്കെ ഇന്ന് ഞാൻ ഫ്രീ ആണ്, എല്ലാം ഇന്ന് ചെയ്ത് തീർക്കാം. ബട്ട് യു ഡോണ്ട് ഡു എനിത്തിങ് ഫോർ ദ നെക്സ്റ്റ് 6 days ആൻഡ് യു lead a bad life and eat a bad food, that's not going to take us anywhere. It has to be a regularized, controlled lifestyle throughout. Then only we can achieve anything. Moderate weight loss. See, this girl has achieved from how she was to how she is now by moderate exercise and weight loss. You have increased the amount of exercise which you have to do, and most important is reduce the sedentary sitting and TV times. One movie if you see on the TV without getting up, 3 hours gone. നമ്മൾ റിയലൈസ് ചെയ്യുന്നില്ല. TV is really addicting. If you see, time just flies. അപ്പോൾ പിന്നെ when you eat something also, when you are watching the TV, that makes it worse. Jump chips, something like this, without realizing we are doing that. So that is the most important one, to avoid sedentary life. That is important. Can take the help of a gym instructor. Advice to young girls, mainly, of course, it's for us also if we are eating this stuff. Mainly because they are the ones who like this food. Sugary drinks, see all this fizzy drinks and then cola and everything, it just has calories. It is not going to help us at all, and it's very bad for health. So the sugary drinks, fried foods, certain oils like palm oil and margarine and sausages, what all a young person will like, it's all bad for health. Okay, sausage, hamburger and hot dogs. Refined carbohydrates like bread, we don't realize that white bread is so much of calories, and pasta and pastries. Of course comes the candy, cake, sweetened yogurt, ice cream. So what do? Better not eat anything, I think. I always say, okay, you can skip this plan, let's say on one day a week, let's say that, okay, we can cheat, but then let it not become a lifestyle of eating this stuff. Okay? So now what foods you include? Green leafy vegetables, bright colored vegetables like bell pepper, pumpkin and all that, carrots, which are rich in antioxidants. Healthy fats, nuts, seeds, olive oil, because oily fish, these are all healthy fats. And also the colored ones, because the more color there is more energy in that. Grapes and blueberries and blackberries and all that. Okay? There are some natural ways people have advised. This has not been really scientifically proved, but there is no harm in trying these ways if we are struggling to maintain our weight and other things in polycystic ovaries. Mediterranean diet, everybody says Mediterranean diet is very good to eat for polycystic ovaries. I already said almonds, cashews, spinach and bananas, lentils, and see, these are all fibers, which is good. Cut coffee, drink green tea, which is more healthy. Supplements like inositol, I will talk in the medication. Chromium, cinnamon, turmeric, of course everybody says now turmeric is very good, even healthy, not even for polycystic ovaries. Vitamin D and calcium supplement should be there. Unless proved otherwise, everybody is vitamin D deficient, because we never go out in the sun. We're all inside from the AC house, we go through AC car into the AC hospital or AC office, go to the AC shops, come back to the AC house. So it's all full of AC, no sunlight. So everybody will be vitamin D deficient. So it's better to check and then take the replacement and keep a vitamin D replacement at a level so that the body is gaining this strength. And this itself can regulate the periods by themselves. Okay? And then zinc. They say now that zinc can increase the immune system and also can control the hair growth on the face, abnormal. Evening primrose oil, period pain, sometimes it's helpful. Usually we give for breast pain. When people have period, before the periods, when they have breast pain, primrose oil is very helpful. But here they say that even it can increase decrease the period pain and oxidative stress. Then berberine is a herb. I have not known about this. It is just I have written there. Then prebiotics is very important. Prebiotics can be increasing the digestion, and also this will regulate the hormone levels. So there's no harm in trying these natural things. So now finally we come to medications. See, point is, depending upon the condition, okay, if the weight is not too much, the main thing is for not getting pregnant, or periods are very irregular, or some problem is there, depending upon the condition of the patient, we will decide to give some medication. It's not that we are going to tell the patient in 6 months you reduce that much of weight and come back, then only I will treat. Because any person who's not able to get pregnant, if you say 6 months, we must think about the stress in the family of not getting pregnant for 6 months. Depending upon the person's condition, we will start. But this is not the primary one, and it is not prolonged medications. These medications are given for short terms for a particular problem. First and foremost is the birth control pills. Suppose a 16-year-old girl comes, her periods are very irregular, and she's got all this acne and some hair growth. Not very much. The testosterone, that's male hormone, is a little high. So I would give the birth control pills called Dian 35 because that has something against the male hormone also for 3 months, 4 months. And then we will tell the person also, okay, you keep an active life, because nowadays girls and boys are very busy with their books and their studies and all indoor. They talk to their friends more through their WhatsApp than personally. Unlike before, no outdoor games, no nothing. So that adds on to the bad lifestyle. So anything which we give plus lifestyle modification, exercise, diet is very important. Then comes diabetes medication. Suppose we have given this, or a person who is not able to get pregnant and she has got this insulin resistance already, we may give the diabetic medications like metformin, which will help in reducing the insulin resistance, but also ovulation it will help. But tanne pregnant ahan chance unda. So we can give for few cycles, and also this will reduce the male hormone. So the hair growth also will be reduced. And there are, suppose the hair growth is too much, it is not, we are not able to control it by these medications. There are specific medications which will reduce the hair growth, and spironolactone and flutamide. The only thing which we have to remember in this hirsutism is abnormal hair growth. The time it will take. But period irregular anengil, ippo njan tablet kodutha, next period only will come. Correct diet. So many other things are very fast, but this hair growth, it may take anything from 6 months or more. So adu adyame nangal parayu, frustrate aagale, especially young girls, they will say, I've been taking these tablets for the past 2 weeks and nothing is happening to my hair. Still people are laughing at me. Okay, so it will take time. When you are doing this, there are additional treatments which, of course, if it's very bad, the girl has to use, because peer pressure, you cannot allow her to go to school and college like this. So some people use the shaving or chemical depilatory agents. The more you shave, the more faster it will come. So, but with treatment, you can use that, waxing. Then some permanent methods are there like electrolysis and laser. These, of course, you have to go to a doctor first, check the hormones, see whether it is how everything is. Then on the doctor's advice, you can do this, no problem. Okay? Then, of course, somebody is not getting pregnant. Idallam matram enough alla, because we need the egg to grow. Suppose medications are there, tablets undu, injections undu. Appo, under the doctor's guidance, we will treat for getting pregnant. Okay? So now, what are the do's and don'ts? We must know. What are the do's first? Maintain a proper weight. See, either it's a vicious cycle. I put on weight, because of that insulin resistance ulladu karanam, male hormone high agunundu, pinna polycystic ovarian will become worse, I will put on more weight. But namakku break cheyan pattiyadu only the weight. If I control my weight, this vicious cycle can be broken. Appo namakku cautious aayittu, we must maintain a proper weight, exercise regularly. Yogas, of course, pranayam, yogas, all these things, they are proved scientifically that it makes a lot of difference and changes the hormones, reduces the stress for the person. So very important. Of course, adequate sleep. Very important, because sleep is a good treatment for all these stress and everything. Because but for the sleep, can you imagine where we will be? So good sleep is important. And maintain a menstrual calendar, because sometimes People are very busy, especially mothers. You are so busy with your children and everything. Eppada last period adu arilla, because you don't maintain a calendar. It is very important to at least have 3 to 4 periods in a year. Otherwise ഞാൻ പറഞ്ഞതുപോലെ ആ endometrium will grow because of the estrogen and there may be problems because of that. അപ്പോൾ ഇതാണ് നമ്മൾ do's. So what you don't do, certain things are not applicable for us. Consume alcohol and smoking, നമുക്ക് വിടാം. Skip meals. See this, especially young girls, അവർക്ക് ഈ I am putting on weight and they will skip meals. What happens? Some people, they skip breakfast, but they will compensate in the lunch. They will eat more. But now what they say is, small frequent meals is more important than big meal, and then suppose I eat one meal but then I eat so much, that's not good. Okay? And sleep too little. Have adequate sleep. The next point is most important. Don't self-medicate to prepone or postpone the period frequently. Once in a while, നമ്മൾ എവിടെ പോകുന്നുണ്ട്, postpone ചെയ്യുന്നുണ്ട് periods, that's fine. That's okay, no problem. But every time, especially in young girls, unnecessary, because many of the hormone tablets are available across the counter, which is very dangerous. So people should not buy any hormone across the counter and take for anything. Okay? So now the key points. PCOS is a very common problem, right from adolescence to menopause. No cure, but symptoms definitely can be controlled and you can become a normal person like any other person. If left untreated, it can lead to major health issues. Lifestyle modification is the key to avoid and manage the problem. So everything, calories, all around is energy, motivation, weight loss, nutrition, move across, healthy food. Okay? So let's transform ourselves and win over this polycystic ovarian syndrome so that the apparently weaker, strong women will become healthy women. Thank you. I'm waiting for all your questions, huh? That's why I need to have interactive session. ആർക്കും ഒരു ഡൗട്ടും ഇല്ല എൻ്റെ ദൈവമേ, ഒന്ന് എല്ലാം മനസ്സിലായി, അല്ലെങ്കിൽ എല്ലാം പോയി എവിടെയോ. യു വാണ്ട് ദ മെൻ ടു ഗെറ്റ് ഔട്ട് ടു ആസ്ക് ക്വസ്റ്റ്യൻസ്? വേണ്ടല്ലോ, നമ്മളുടെ മെന്നല്ലേ. ഇറ്റ്സ് ഓക്കെ, സാരമല്ല. You want the next? Don'ts you want? The other one was do. This is don't. So, ഞാൻ പറഞ്ഞതുപോലെ be conscious about what is happening in your life, personal life. Don't get carried away by the family. Be conscious, and then we will put on weight very gradually, but then suddenly you realize that you have increased some 10-15 kilos. So be on the lookout, especially young children, your girls. Mothers are also, of course, including my mother even at this age. Oh, eat, no, this is good, eat. But then healthy food. Weekends you can take them out and then give all the junk food, because after all, one life. You cannot tell a 15-year-old girl to eat only this Mediterranean diet and everything for lifelong. It's not worth it, but let it not become a habit. Weekends, definitely they can go out, they can eat junk food, but compensate on the other days. More than that is physical activity for these young girls and boys. Because now so much on the computer, they are all hooked on their computer. No physical activity, no outdoor games. It's got many vegetables and everything. Okay, I think on Dr. Google will tell you exactly what is Mediterranean diet. So you can go for that and then see. But best is to see a dietitian. If you want to do what to do, best is to see a dietitian so that they will calculate the calories according to us. Our calculate cheyum etra calories reduce cheyanam endha edana. Yes, JC. Intermittent fasting in life, yes, nowadays people are saying intermittent fasting is good, okay? But on a regular basis, don't skip one meal. Okay, I don't take breakfast. Like that, don't skip meals. That's the thing. Intermittent fasting is okay, no problem.
PCOD girls, can they get pregnant?
They can get pregnant. That's what. Just because they have PCOD, it doesn't mean that they are not ovulating. Suppose we will do the hormones and all and see, many people will still ovulate. Anganeyanankil, it's okay. But if it is not, we have medicines. Millions of people with polycystic ovaries have become pregnant and got many children. No problem.
Getting pregnant, having children, will they still have the,
Up to menopause.
will be there?
It may be there, may not be there. It can, see, all this hormonal thing, like it may get corrected by itself, but it may come back again. That's why consciously we have to be careful. It can come even up to menopause, some women. Up to menopause sometimes. So that's why. But people see family history, then obesity, especially obesity, the weight, very important. There are some people in a particular this thing it's high, but all over the world it's coming. Because see, they are treating even the cattle and everything with hormones. There are so many things, even nothing we eat is all healthy. So it's all, so many things are happening. Insulin resistance has become so common nowadays.
PCOD has become very common nowadays. because
Nowadays.
lifestyle
Nowadays, yes. Definitely the lifestyle.
habits and all.
So mothers have had, now the daughters will be worse because their lifestyle is very bad. Nobody just sat at home. See how active we were when we were children. Outside. For them activities and the education also is so much now, no? No doubt for the men. Even anything you can ask me. Or even after the men go out, you can ask me separately. No problem. Unless the person becomes so obese that they go for bariatric surgery. Nothing. Even for infertility, they were saying ovarian cauterization and all that. That is now, it's out of vogue. No surgery.
So once if you reduce the weight, this will come.
It will get,
Or the condition will go.
condition will get controlled and it may go. Because your weight reduction will reduce the male hormones. It will reduce the insulin resistance. So then the hormones get corrected itself. So it will be okay.
Then the circles.
Yeah, exactly. So for 6 months if I am doing, then after that, after 1 year, if I forget, again I'll get. So constant awareness of our life and weight and healthy lifestyle is the most important. No. Sure. No, you can ask anything. It's very easy to get a gynecologist like this. You have to wait for my appointment. Please ask anything you want to ask. Yep.
After the hysterectomy, how often you have to go for a checkup? Is it, how often?
After a hysterectomy, without ovary removal, depending upon how the ovaries are, the doctor will tell you whether to come for the scan for the ovaries after 6 months or 1 year. But after a hysterectomy with ovary removal, no need to check for that, but for breast and the gynecological checkup every year definitely. Especially above 40, every year you have to come. See, pap smear has to come every 3 years. Pap smear is to find out any abnormal cells in the uterus in the mouth. Every 3 years, how many of you had pap smears? I don't know. Every 3 years you have to have, every 3 years, okay? After 40, mammogram and ultrasound every year, okay? At least gynecological checkup, and you should check your sugars and cholesterol and creatinine, all those things also. Better to keep health and this applies to men also. Sugar and cholesterol and everything every year you have to check. If there is a family history, start earlier. Self-breast examination every month. most of the breast cancers are diagnosed by the women themselves. Apo, sorry men, close your ears, but you can listen, no problem. Check your breasts every month after your period and get used to the feel. If there is any lump, pain or discharge, especially after 40 years, report to the doctor. Especially if there is a family history of breast cancer, uterus cancer, ovary cancer, colon cancer. Any cancer history in the family, see these are the ones that run in the family, uterus, ovary, colon, breast. There are like leukemia, bone cancer or not, but definitely check your breasts. If you check before periods, there may be some lumps, which may be normal, so after.
Along with that bilateral
Oof.
in that case also have to follow up.
There is no need for follow-up for the pelvis. There's nothing there. But breast is there, no? Breast exam you have to come. Every year gynecologic checkup for breast exam for those patients. No need for, unless it is done for cervical problem. Like suppose intraepithelial neoplasia or something. But that doctor will tell you. Otherwise there is no need to come for that. Early menopause is before 40 years. Appo namukku we must come and see a doctor why there is early menopause. Sometimes where endengilum undo, like autoimmune thyroid endengilum problem undo na. Hormone replacement should be discussed with the doctor. Many factors are there. Where a compound factors undo, diabetes undo, blood pressure undo, family history undo. Adella vachittu the doctor will decide whether you can take hormones.
How early can the menopause come?
Average age is 51, but it depends upon lot of factors.
In 30s also?
No, it's abnormal. Below 40, it's abnormal. 30, nobody should attain. There is something grossly wrong if it's 30. So period doesn't come at 45 also, it's not menopause. Menopause just like on the drop of hat comes. You are still young. At 46, 48 also, it will not come. So. Unless you check your kidneys for any stones or anything, one ultrasound cheyadu nokkana better na. Amma endengil undengil calcium കഴിക്കാൻ പാടില്ല. Otherwise calcium is good. At least bone health will improve. Hello. No connection.
Certain study shows that the calcium intake might lead to colon cancer, something like that.
No.
No?
Not proved, definitely. But always keep checking because sometimes more common than that, sometimes it can cause kidney stones, calcium stones. So that's the karanam. You always have to balance between whatever it is. Vitamin D you check and give, no problem. But calcium and all no need. They must get everything from the food. You should not give tablets for them at that age. Unless there is a deficiency or thyroid. Estrogen tablets should never be taken by yourselves unless a doctor prescribes. Very, very dangerous. Estrogen alone, if they have not had the hysterectomy, can cause uterine cancer. So, any hormones doctor matrame prescribe cheyanam. You should not take across the counter. Of course, Primaloten, sometimes period postpone anengil 1 week. Okay, but every time you should not take Primaloten. Don't play with the hormones and get into trouble. You can have Panadol, simple Panadol, or even have this mefenamic acid or Ponstan, all that. But in spite of all this, if it's severe pain, she's fainting, vomiting, please bring. There's something called endometriosis which can cause the severe pain. Ellarkum endometriosis alla. Every girl will have something, but if it is persistent and very severe, not getting better with all these painkiller tablets, you should bring them to the hospital. Allengil ee tablets alla kodukam, kodapilla.
What is the importance of checking the thyroid in pregnancy?
No, checking the thyroid itself even without pregnancy is very important. Every pregnant woman, first visit in the first trimester, first 3 months. First visit, we always check thyroid. Because low thyroid should be treated in the first 3 months because that can affect the baby's brain growth. very important. All the hospitals, everybody will check the first visit itself. 5 weeks, 6 weeks, ellam kudi. Yeah, that's what. So you should, thyroid is very, very important. No doubts? Endometriosis लंबा कहानी है. Endometriosis is presence of the lining of the uterus called endometrium outside the uterus. Simple as that. They can have ovarian cysts, they can have in the pelvis, they come with severe pain, pain during period, ella. Different treatments depending upon how severe it is, how much a symptom, whether patient wants to get pregnant or not. Medication, surgery. It's a big topic. Only medical person can treat endometriosis. No over-the-counter tablets can be given. Pap smear, mammogram, ultrasound, breast, very important. Okay, if somebody has not done, please. For 47-year-old during period on the second day, severe bleeding. Better to come to the doctor. Ultrasound ചെയ്ത് നോക്കാം. ഫൈബ്രോയിഡ് ഒരു മുഴ പോലെ, ഫൈബ്രോയിഡ് എന്ന് പറഞ്ഞാൽ ഒരു മുഴ പോലെ, അതുപോലെ സംടൈംസ് പോളിപ്പ് ഉണ്ടാകാൻ ചാൻസ് ഉണ്ട്, ഓർ ഹാർമോണൽ ഇംബാലൻസ്. ബെറ്റർ ടു കം ടു ദ ഡോക്ടർ ടു ഡു an അൾട്രാസൗണ്ട്. ഫൈബ്രോയിഡ്സ് അതുപോലെ സംടൈംസ് ചെറിയ മുഴയുണ്ട്, ഫൈബ്രോയിഡ് ചെറിയ ഫൈബ്രോയിഡ് ഒന്നും ചെയ്യണമെന്ന് ആവശ്യമില്ല, അൺലെസ് ഇറ്റ് ഇസ് ഇൻസൈഡ് ദി യൂട്രസ്. So anything excess bleeding or no bleeding, come to the doctor. Excess bleeding, especially above 40-45 years, and most important one, good I remembered, after menopause, any bleeding is abnormal. Don't wait. Menopause parembo 1 year no bleeding. Even after 45 years, suppose periods are coming 2 to 3 months la varnundu, normal period, you can wait, no problem. But suppose 10 days la period varunadu, adu kanjittu 1 month la period illa, again 15 days la, that is very, very, very important. Must come to the doctor. We must find out what is wrong. Sometimes a gland overgrowth ayirikam, sometimes it can be cancer. So very important. Adupole at least we will find out what are they. But anybody after 1 year of no period, definitely abnormal. We need to find out what is wrong. Everybody cancer alla, but we need to rule out what is there. Adepole, sorry, every woman who has bleeding after sex, abnormal, come to the doctor. Okay, it's not normal. No other doubt? You can use. You can. It's not advised. Not advised, but you can use whatever you want. Hygiene is the most important one. That's all. Otherwise, it's fine. No problem. Tampons or menstrual cups or whatever. Many people find it very convenient. No. Because we don't know how the hymen is going to be. Tomorrow that would be should not complain that the hymen is not intact. You understand the implications. So only after marriage this should be there.
But the material and all, it's not cancerous or anything?
Nothing. That's all fine. That's fine. It's not going to be there all the time, so that's fine. That's all fine. That's it. When I come down also, you can ask me question. I am available. Through Daisy, I am available all 24 hours, 365 days a year. Anytime, any doubt. Thank you so much. Once again, praise the Lord for this blessing.